When James Dean Trepanier was prescribed benzodiazepines for pain after surgery, he says his doctor told him nothing about the drug he was taking or its side effects.
I had like 30, and he says, you won't be taking it every day, so when you come back and if you need more, well, I'm gonna give you more. And
he did get more and ended up taking the pills on and off for 8 years. When he later quit, he says the withdrawal was unbearable.
Severe anxiety. Can't sleep. If you go to sleep, I'd go to sleep and I'd hear like gunshots in my head. Waking up, cold sweats.
Radio-Canada's investigative program Enquête spoke with 12 people who had similar negative experiences with benzodiazepines or hypnotics.
These medications are also called sleeping pills, anti-anxiety medications.
Experts say while the drugs can be effective to treat those conditions in the short term, some warn they're being overprescribed and used for long periods of time, and that doctors and patients don't always know the risks.
There is a need for public health leaders and health ministries to put attention towards benzodiazepines because they are behind a number of health issues.
Those can include falls, fractures, and addiction. Gagnon says about 1 in 10 people in Canada has been prescribed a benzodiazepine or hypnotic at some point. Among seniors, it's 1 in 4.
They're dangerous drugs, and so they never should be prescribed long term.
Despite warnings like that, the drugs are sometimes prescribed for years. They're meant to be used for days or weeks, says this expert, who has helped people get off benzos safely to avoid dire symptoms of withdrawal.
One of them is what we call akathisia, just severe restlessness and inability to sit still. We don't have any treatment for that. It's just a horrible feeling.
Allison, can you walk us through what's being done to cut down on this problem of overprescribing?
Well, professional orders in some provinces have issued guidelines and standards. Alberta's College of Physicians and Surgeons says the ideal duration for benzodiazepine prescriptions is 3 to 7 days. Nova Scotia's college says initial prescriptions should be limited to 2 to 4 weeks. Now, here in Quebec, the College of Physicians says that it's starting to keep track of which doctors are prescribing these drugs the most. And it says that's not to sanction them, but it wants to know who they are and to work with them to make sure that they understand how to prescribe them safely.
All right, lots of people will be watching this. Allison Northcott in Montreal, thank you.